evening. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for another Facebook Live session. I am joined tonight by Dr. Kelly Grimm. She's a clinical audiologist at Hartford Hospital. Thank you so much for joining us.
Hi, thank you for having me.
This is a really interesting topic, hearing loss. There's lots of myths out there. There's lots of misconceptions, so we're going to try to delve into that. We also encourage you to ask Dr. Grimm any questions that you want about hearing loss. First up, though, this is a common condition as we age. Let's talk numbers first. How common is this as we get older?
So it's actually the third most prevalent chronic condition behind hypertension and arthritis. And so we suggest everybody get a baseline hearing test, usually between the ages of 40 and 50, because it's starting to creep up on us earlier. More people are recognizing it at a younger age than ever, and so that's why we're suggesting people to kind of get on top of it so that we can monitor you a little bit closer than we used to.
Yeah, and so hearing loss, define hearing loss, because, and this is one of the misconceptions, I didn't know this, is that you think hearing loss, you think volume, that I can't hear you, but it's not. It's talk to us about that.
It's very interesting because the way our ear is organized, it's organized from high pitch to low pitch. And typically, with age, we lose those higher frequencies first. And so the term hearing loss, generally people think of as being a volume deficit. In reality, volume is actually the last thing to go. People start to notice issues with understanding speech, especially in noise. Your parents, your grandparents, you might notice you say something to them, but they respond with something completely different. Issues with repetition, saying, say that again, and then their response is usually, I can hear you, I just don't know what you said. So the first thing to go typically with quote unquote hearing loss is actually issues with clarity and understanding speech long before volume really steps into the picture, really becomes an issue.
Right, and then I think you're on two different wavelengths because you're talking louder,
exactly,
which that's not the issue. So I think that's so interesting.
Right.
How do you know when to go and see a doctor? Like if you are just maybe having a hard time understanding somebody, but it occasionally happens, how do you know? What are the symptoms?
I mean, honestly, that's the first thing, and usually the patient is the last one to know about it because you don't know what you're missing. Think about that. So it's usually everybody else around you is the one that has the problem with you.
Right.
You know, they're tired of repeating. Or even yourself, if you suspect, I don't think I'm hearing as well in this situation as I used to, that's good enough reason to go ahead and get that baseline hearing test. And at least if it's normal, then we kind of tell you to come back and add it to your list of things to do every year. Go ahead and get your hearing checked because that baseline is a good starting point for us to kind of tell how your hearing may change in the future.
And that should start in your early to mid-40s to get that baseline?
I would say 40 to 50, that's kind of what we suggest. Yeah.
And what can you expect from the hearing loss test? What happens? What do you do?
So the first part, we typically just take a peek in the ears first to make sure the ear canals are free of any debris, earwax, that sort of thing. And then we'll generally kind of put you into the sound booth and we'll test different frequencies from low pitch to high pitch. And we'll kind of come up with a graph of your hearing, how you hear at each one of those specific frequencies. And then compare that to what we would consider being in the normal range. And that'll give us your degree of hearing loss. And then what we do is the second part is some speech testing. So we'll give you a little bit extra volume to compensate if there's any hearing loss there, and we'll have you repeat back some words. And that'll tell us what is your ability to understand words or what's your potential for clarity of speech. And so that's the second part of the hearing test. And then all of that put together, we kind of review it, see if you're a good candidate for amplification, which is obviously the best treatment for hearing loss at this point, and go from there.
All right, we do have a question on Facebook Live here
Okay.
from Barbara. She says, I am 86, have hearing aids, and still cannot hear well enough. How can I work with the audiologist to correct this so I can hear better?
So Barbara, think about first if your issue is that you can't hear, meaning things aren't loud enough, or that speech isn't clear. Because typically when you go into your audiologist and you say, I can't hear, what that means to us is we need to make things louder. But if it's just that, I can hear my daughter's talking to me, but her voice isn't clear, then that's a completely different adjustment of the hearing aids. So first, really think about what is the issue that you're having. Is it a volume issue where we need to make, just in general, things louder, or a specific issue where things just aren't clear, okay? We also then, the audiologists kind of look at that portion of your hearing test, the speech testing, because that gives us a percentage in the end. For example, you have 96% ability to understand words, and that's very, very good. But there are some people, unfortunately, that only have 75% ability to understand words. So then we get into talks about realistic expectations from the devices, because what that means is that regardless of how loud we make the hearing aids, speech is not necessarily going to be 100% clear for that person. Your ear only has the potential to understand 75% of speech. So I would say, again, think about, Barbara, is it an issue with volume or is it an issue with clarity? And then that'll help your audiologist to kind of fine-tune them or program them for you appropriately.
Yeah, interesting. We're talking to Dr. Kelly Grimm. She's a clinical audiologist at Hartford Hospital. There is a free class coming up with Dr. Grimm as well as Dr. Mark Eisen. That's on March 15th. The number on your screen, 1-855-HHC-HERE. Call that to register for that class. We're talking about understanding hearing loss and all that goes into it. There's quite a lot. Let's talk about that common myth that you hear often about that sort of bugs you a little bit. What is that?
Well, the most common myth that I get in my office on a daily basis is that my hearing is normal for my age. So in reality, there are no norms for hearing. Because hearing loss is such a gradual process that varies from person to person and takes into consideration genetics, noise exposure, and other medical factors, there's really no degree of hearing loss that's associated with a specific age group. So that's why we suggest everybody get a baseline so we know where you start, and then as you age or if you have a traumatic incident with your ear or something, we can at least look back and kind of see where you were.
Noise exposure, obviously a lot of folks nowadays with cell phones, earpieces, Bluetooth contraptions, music headsets, headphones. How dangerous is that, or how can that affect your hearing?
Luckily, the majority of those products are in some way regulated, meaning you can only turn them up so loud. Obviously, you can certainly get them to a loud level, but it's the repeated exposure to the loud sounds that's really traumatic to the ear. You hear kids driving down the street with their cars thumping. That's obviously not good, but it's also, believe it or not at a level that will cause instant hearing loss. So it's kind of over time, the repeated trauma with loud noise to the ears that puts you at risk for noise-induced hearing loss.
And what about hearing loss if it's left untreated? This is something we were talking about earlier, which I found to be so interesting, that it can lead to serious health conditions.
Unfortunately, we've noticed there's been studies done that have linked untreated hearing loss with dementia and other cognitive disorders. And the reason being is that it's linked to a theory called use it or lose it. So it's basically, think about any other function in your body. If you left it untreated or you don't use it, you lose it. And so those with untreated hearing loss are at a 30 to 40% greater risk for cognitive disorders versus those without hearing loss. And it's basically the brain isn't being stimulated by sounds. And so if it's not being stimulated for an extended period of time, it kind of forgets about it. It loses its ability to recognize it.
And we're talking about such conditions as dementia and Alzheimer's even too?
Exactly. And think about those disorders. Again, it's sort of like muscle atrophy of the brain. If the brain isn't being stimulated, it forgets about it. And it's the same thing with hearing and being able to recognize speech. So that's why it's important to transition into wearing hearing aids sooner rather than later, so that we kind of keep the brain stimulated. We don't hear with our ears. The ears are basically just the doorway to the brain, is what I like to say, but we hear with our brain. So that's why it's important to kind of keep it stimulated so we can...
Another common misconception.
Absolutely.
Too.
Absolutely.
So again, we're talking to Dr. Kelly Grimm. She's a clinical audiologist here at Hartford Hospital. Please ask a question. She's here live. Anything you want to know about hearing loss. One thing I want to talk about is ear hygiene. And that's a big topic. We talked about Qtips earlier. and how dangerous that can be. And I'm sure there are a lot of Q-tip users out there that clean their ears with. Why is that not a good idea?
In theory, you're essentially pushing into the ear further what you're really trying to get out. So if you think about kind of the circumference or the diameter, the opening to our ear canal, and you think about how big that tip of the Q-tip is, you're not really going alongside the earwax like we are when we clean out ears. We kind of go along the side of it, kind of get behind it and pull it forward and out. With the Q-tip, you're not able to do that. So basically what you're doing is anything that's in there, you're kind of pushing back with the Q-tip and then just kind of cleaning out, you know, the fresh residue or fresh earwax, for lack of a better word, that's really at the opening.
And over prolonged use of using the Q-tip method, can that create hearing loss?
Absolutely, because what happens, and we see it every day, is that people create impaction. I mean, all that wax that they've been pushing in and in and in further eventually gets pushed up against the eardrum with nowhere else to go. And so earwax really only becomes a problem when the ear canal becomes completely full. Otherwise, it serves a purpose. It's there to kind of protect the ear from debris and environmental agents and so forth. It's naturally secreted by the body. So everybody produces different amounts, and it really only becomes an issue when it completely occludes the ear canal. Otherwise, eventually, it works itself out on its own.
What is the proper way that folks should be cleaning their ear? Is there a proper way, or just leave it alone?
Just let it be. And if you suspect...
It'd be hard for some folks out there.
It definitely is. If you suspect an issue with earwax, you know, where you feel like your hearing is muffled or it's not as good as it should be, then that's when you want to contact a physician to kind of get your ears cleaned out professionally. But don't try it at home.
Yeah, don't do that at home. Tinnitus, that's the ringing in the ear. That's another common condition that folks often probably come to see you about.
Yes. Tinnitus is very frustrating for people, especially because it doesn't necessarily have an etiology or a cause behind it. You can have completely normal hearing and have ringing in the ears, which means that it could be genetic. It's also associated with hearing loss. So a lot of times those frequencies that are involved with hearing loss can sometimes be the same frequency that people hear the ringing in their ears. So it doesn't but again, you can have no hearing loss and have ringing. So it doesn't necessarily have to be related to something. We also know that there are some things that exacerbate tinnitus or ringing in the ears. Stress is a biggie, obviously, like with anything else. Caffeine, certain medications, antibiotics. Some people say salt and alcohol. So we know those are some things that make it worse. But unfortunately, there's usually not a treatment for tinnitus in terms of, or a cure, I should say. It's basically we're trying to get the brain to habituate and think of something, or kind of pay attention to something else besides the ringing in the ears.
Okay. Yeah. We have another question from Carol Ann. She says, can ear infections, also known as swimmer's ear, early in life impact hearing in later years? And what about if my child had had tubes to mitigate this issue? It's an interesting question.
It is. I would say that's a better question for Dr. Eisen, who's the neurotologist that'll be giving the class with me next week, because he deals with more of the medical side of the ear and the anatomy more so than I do. But from what I understand, tubes in the ears obviously is the treatment for chronic ear infections to kind of drain the fluid from the middle ear space. Most of the time when those tubes come out, which is usually like after 12 to 18 months, the eardrum should kind of heal on its own. There are some cases where kids who have had repeated sets of tubes, where once the tubes come out, that hole sometimes doesn't close. And if we have a hole in the eardrum, it could potentially cause some hearing loss. Swimmer's ear, from my understanding, is more of kind of an external ear infection, so it affects more of the ear canal. Depending on the treatment for swimmer's ear, especially years ago, sometimes, it could have caused some hearing loss. But again, that's probably more of a question to kind of give Dr. Eisen next week if you're able.
Yeah, I was going to say, so Carol Ann might want to check out the class next week, March 15th, with Dr. Grimm and Dr. Mark Eisen. That will be held next week on March 15th. You do need to register for that class. It's 1-855-HHC here to sign up. It should be interesting. Dr. Grimm, thank you so much for
Thank you for
sharing your
having
time
me.
with us. We appreciate that.
Thank
We
you.
learned lots tonight. Hope you did too. I'm Tina Barona for Hartford Healthcare. We'll see you soon.